Hi there, this is Dr. Jeff Snyder, and right now I want to talk to you a little bit about neck pain and chiropractic care. Our neck is also called our cervical spine. It begins at the base of the skull and it contains 7 small vertebrae. Incredibly, the cervical spine, it supports the full weight of your head, which is an average of around 12 pounds. While the cervical spine can move your head in nearly every direction, this flexibility makes the neck very susceptible to pain and injury. The neck's susceptibility to injury is due to, in part, the biomechanics. The activities and events that affect the cervical biomechanics include extended sitting, repetitive movement, accidents, falls, and blows to the body or the head, normal aging, and everyday wear and tear. Neck pain can be very bothersome, and it can have a variety of causes. Here are some of the more typical causes of neck pain. Injuries or accidents, growing older, osteoarthritis, spinal stenosis, degenerative disc disease, and daily life poor postural type issues. So accidents or injuries, examples, sudden forced movements to the head of the neck or the neck in any direction, and it results in a rebound in the opposite direction. It's known as whiplash. The sudden whiplashing movement injures the surrounding and supported tissue and the neck and the head. Muscles react by tightening and contracting, creating muscle fatigue, which can result in pain and stiffness. Severe whiplash can also be associated with injuries to the intervertebral joint discs or ligaments or muscles or the nerve roots. And car accidents are the most common cause of whiplash. As we get older, degenerative disorders such as osteoarthritis, spinal stenosis, and degenerative disc disease can affect the spine as well. However, growing older in itself is not the problem. It's the way we take care of our spine over the course of time. The hygienic issues related to when we grow older, the wear and tear can cause those types of problems to occur when not maintaining your spine properly through life. So osteoarthritis is another hygienic issue, but it is a common problem as well, and it can cause progressive deterioration of the cartilage. The body reacts by forming bone spurs that affect the joint movement. And spinal stenosis is one other grade as well, which causes the small nerve passages in the vertebra to narrow, which causes compressing or trapping of the nerve. Stenosis may cause neck, shoulder, or arm pain, as well as numbness. And when these nerves are unable to function normally, it can cause big problems for you. And daily life gets in the way, unfortunately. Poor posture, obesity, weak abdominal muscles often disrupt the spinal balance, causing the neck to bend forward and to compensate. Stress and emotional tension can also cause muscles to tighten and to contract, resulting in pain and stiffness. Postural stress can contribute to chronic pain with symptoms extending into the upper back area. So how does chiropractic care help with neck pain? During your visit, I'll perform an exam to locate the source of your pain, and I'll ask you a series of questions about your current symptoms and give you and the remedies that you've already tried. For example, when did the pain start? What have you done for your neck pain? Does the pain radiate or travel to other parts of your body? And does anything reduce the pain or make it worse? I will also do a physical exam and a neurological examination. In a physical exam, I'll look at your posture, your range of motion, the physical condition, noting movements that you cannot do because of the pain. And I'll also feel your spine, and I'll note the curvature, the alignment, and I'll feel for muscle spasms. I'll also check your shoulder area during this examination as well. During the neurological exam, I will look at your reflexes, your muscle strength, and nerve changes, and where the pain spreads to. In some instances, I may need to also do some other diagnostic tests. X-rays often will show narrow disc spaces, fractures, or even bone spurs or arthritis. A computerized test called a CT scan or a magnetic resonance imaging like an MRI can also show bulging discs or herniations. And if there's nerve damage is suspected, then what I may have to do is order a special test called an electromyography, called an EMG, to measure how quickly your nerves respond. If I diagnose a condition that's outside of the normal conservative scope, such as a fracture or an indication of some type of organic disease, I will refer you to the appropriate medical physician or specialist to manage those conditions. I also may get your permission to inform your family doctor about the care that you're receiving to ensure that your chiropractic care and your medical care are properly coordinated. The primary thing that I will do in the office is what's called a chiropractic adjustment. The neck adjustment is a precise procedure that is applied to the joints in the neck, usually by hand or by instrument, and a neck adjustment works to promote the proper mobility of the spine and to restore proper range of motion. It takes the pressure off the nerve to allow your body to function properly. It can also increase movement in the adjoining muscles, and patients that typically also notice an improved ability to turn and to tilt their head, and a reduction in pain, soreness, and stiffness. Some may be wanting some proof, so I have some information here to share with you. I'm going to read from it right now regarding the literature. A review of scientific literature found evidence that patients with chronic neck pain enrolled in clinical trials reported significant improvement following chiropractic adjustments. As part of the literature review published in March and April of 2007, the issue of the Journal of Manipulative and Physiological Therapeutics, the researchers interviewed reviewed 9 previously published trials, and found high-quality evidence that patients with chronic neck pain showed significant pain level improvements following spinal adjustments. No trial group was reported in having remained unchanged, and all groups showed positive change up to 12 weeks post-treatment. Now, another study funded by the National Institute of Health and published in the Annals of Internal Medicine in 2012 tested the effectiveness of different approaches for treating mechanical neck pain. 272 participants were divided into 3 groups that received either spinal adjustments from doctors of chiropractic, pain medication, over-the-counter pain relievers such as narcotics and muscle relaxants, or exercise recommendations. After 12 weeks, about 57% of those who met with chiropractors and 48% who exercised reported at least 75% reduction in pain. Again, 75% reduction in pain, compared to 33% of the people in the medication group. After 1 year, approximately 53% of the drug-free groups continued to report at least 75% reduction in pain, compared to just 38% of the pain reduction amongst those that took medication. Also, in 2012, research published in Spine Journal analyzed the prevalence, patterns, and predictors of chiropractic utilization in the United States general population. The research found that back pain and neck pain were the most prevalent health problems for chiropractic consultations, and the majority of users reported chiropractic helped a great deal with their health problems and improving overall health and well-being. So, if you are one of these people that is questioning the use of chiropractic care, or you're having problems that you know that we already described above, and you have either sought chiropractic care prior, or you're looking for a second opinion, please contact us, and I'll be happy to help you in determining if chiropractic is the right choice for you at this time in your life. Thanks once again for watching.